Tonight, the World Health Organization is sounding the alarm, saying the global risk from the Omicron variant of the coronavirus is very high. They say that is based off of early evidence. Now, keep in mind, this is a new variant, so we're still learning about its effects. But in a memo, the WHO says it could lead to surges with severe consequences. It was first detected in southern Africa, and today is actually the first day of travel restrictions in the United States, keeping non-U.S. citizens from entering the country from South Africa and 7 other nations. You see on your screen, the variant has spread, reaching at least 14 countries, including our neighbor to the north, Canada.
We needed time to give people an opportunity to say, get that vaccination now before it heads. It's going to move around the world. I think it's almost inevitable there will be, at some point, that strain here in the United States.
And experts are still waiting to learn just how transmissible this variant is and whether it causes more severe disease. We don't know that just yet. But another big factor in all of this is how well our vaccines will hold up against Omicron.
It has similar mutations in Delta, and then it has additional mutations. And so it stands to reason scientifically that the transmissibility would be at least the same, if not more, than these other strains.
Vaccine manufacturers say it will take about 2 weeks to learn whether or not their drugs work against this variant. Now, despite that, health officials say now is the time to get vaccinated or get your booster shot. The CDC just strengthened recommendations to include all adults for boosters. One thing that is clear, scientists were intentional with how they named this variant. Let's take a deeper dive on that, because since May, the WHO has followed the Greek alphabet to label variants in an effort to keep people from referring to them by the location where they were detected. So the expectation was that this new variant would be classified new because it's next in line, because a mu variant was designated in August. But social media users quickly pointed out that the health agency skipped new and subsequently Z. But a spokesperson for the organization says it comes down to keeping it simple and not offending anyone. New, spelled N-U, is too easily confused with the word new, N-E-W. They also skipped Z because it's too common of a last name.